Hello, everyone. Today we're going to talk about COVID 19. Some of the topics that we're going to cover: what is COVID 19, how it spread, signs and symptoms, the transmission routes, like how can we prevent it, infection control procedures, social distancing, hand washing, and disinfection. So, what is COVID 19? COVID 19, I'm sure at this point we've all heard of it. We've all been affected by it, if not directly, maybe indirectly with a loved one. So I'm sure we have some kind of basic knowledge of it, but it is an infectious disease caused by SARS virus. And SARS, if you don't know, it's severe acute respiratory syndrome, which is a respiratory illness caused by coronavirus. The first known case was identified in Wuhan, China, and that was back in December of 2019. Everything was shutting down at the time, and it was so new, and nobody knew what was going to come of it, what was going to happen. It was just so much going on at that time. How does it spread? Well, many different ways. It can be spread by respiratory droplets. So anyone that coughing, sneezing, touching objects, coughing in your hand. If you're in close proximity to someone that's infected, you can also spread it that way. So I included this slide. I thought it was really interesting, where you can actually get a visual picture of it. So one person infected can potentially, after 5 days, infect two people. And then after about 30 days, those two people can go out and infect 406 people. That is amazing. That's unfortunately amazing. The way that this thing can spread, and from one person, how many people, how many lives can be touched. And just think about that number, 406. If 406 people are infected, then that number can triple and quadruple and go out and infect, many more. So who's at risk? Pretty much everyone at this point. In particular, we have to think about our patients and the older populations, the patients with compromised immune systems, even infants, 65 years of age and older, people with chronic lung disease or asthma, anyone with cancer or cancer survivors, diabetes, anyone with serious heart conditions like congestive heart failure, and obesity. If you are overweight, you are in that category. You are at a high risk for getting infected with any virus, in particular COVID 19. And shoes spread COVID 19 virus? Yes. Many of us are in and out of facilities. We go into stores. We are probably going into these patients' homes. Over the past few months, I've been in and out of hospitals and nursing homes doing clinical rotations. And there's so much you come in contact with, and just by being in the store. So I have developed this routine that whenever I get home, you don't know what germs you've contracted when you're out and about and when you're caring for these patients. So when I get home, I make sure I go through the garage, and I have a little setup there where I take my shoes off. I have some sanitizing spray that you can spray on your body, like on your clothes. I spray myself down. I place my shoes, I spray my shoes and I wipe them down and I place them on this, it's kind of like a napkin. It looks like it almost looks like a chucks, but you can also use like paper towels or something that's easily disposable. I place my shoes there to let it dry overnight. Because, like I said, you don't know what you're bringing in to your home. You don't know what you're picking up, and what you don't know what you're gonna bring to those patients, and you don't know. It's not like everyone walks around with medical alert bracelets or something saying, "Hey, I have a compromised immune system." What does that look like? It looks just like you and I. You don't know what anyone has, so you should treat everyone as if they are infected. So, yes, shoes can transmit this virus. The likelihood of COVID-19 being spread on shoes and infecting individuals is very low. But as a precautionary measure, particularly in homes where infants and small children crawl and play on the floors, consider leaving your shoes at the entrance of your home, or of your patient's home. This will help prevent contact with dirt or any waste that could be carried on the soles of the shoes. You're walking on these patients' carpets. You just don't know. There are many patients that have support animals, so you don't know what the animals are picking up. Animals can also transmit infections as well. And what about the packages? This is a good topic. Many people don't think about that. I remember back at the beginning of 2020, when we didn't really know. I said 2020. I want to say 2019. Didn't really know much about the virus, so we were spraying everything. We have a protocol at the office. Whenever packages come, whenever mail come, we spray it down, let it sit for a while, because you don't know what these carriers are bringing in, what these products are how they're being shipped. You don't know their personal hygiene. So, can coronavirus be transmitted through food, packaging, or similar surfaces? The virus may survive a few hours on surfaces and instruments that people touch, including takeout containers and utensils. However, simple household disinfectants can kill it. How long is the virus detected on surfaces? Plastic, 2 to 3 days. Plastics, 2 to 3 days. We talked about packages. Look at the cardboard. It says 24 hours. Stainless steel, 2 to 3 days. These are things that we get and we touch on a regular basis, all day, every day. We get packages, we get mail. We are cooking. We're probably in and out of facilities. We're in these patients' homes. We're getting bottles of water, or any type of beverage. You just have to be careful because this virus can live on these surfaces for some time. What are the signs and symptoms? So we're going to talk a little about some of the signs and symptoms of COVID-19, so that you would know what to look for. Now, of course, we hear people say, "Oh, it's just my sinuses, it's just my allergies." But how do you know? Just because you deal with allergies, this virus has been around for some time now for us not to want to take precautions to protect ourselves and protect everybody else. So some of these signs are cough, especially if the cough has been lasting for a few days, fever, chills, muscle pain, shortness of breath or difficulty breathing, sore throat, loss of taste, a smell. So you want to know when to seek immediate medical attention, especially if you're having trouble breathing. It's a good idea to maybe get a pulse ox. And that's a little, if you don't know what a pulse ox is, it's the little, a little device that you put on the tip of your finger, and it checks the oxygen, your oxygen level. You can find this at your local store, like a CVS or Walgreens, even Walmart. You can go directly to the pharmacy counter and you can ask them for a pulse ox, portable pulse ox to put on your finger so that you can keep it with you. You just never know when you're going to need it. Sometimes you may develop confusion, like bluish lips or bluish in the face, persistent pain, repeated shaking, chills, sore throat, headache. Lately, these symptoms have been very minimal, which seems just like you're having just your regular sinus issues. When in doubt, I would say just go and get it checked out, because you just never know. Routes of transmission. So how can it be transmitted? Now, we did talk about airborne, droplets from coughing, sneezing, sharing beverages with people, sharing utensils. You can be in the hospital visiting someone. There are air droplets everywhere. You never know when you're going to be in contact with an infected person, especially in enclosed settings where you're going to be with them for long periods of time, like on a bus, on a train, on a cruise. That air circulates. So we have to think about some precautions that we can do to help control this virus. Most common, again, is direct contact with the infected person, air droplets. So this virus is airborne. Airborne means that you can contract it just from breathing. Someone may have been in the area that has been infected, or in an enclosed setting, like I mentioned, like in a hospital rooms, bathrooms. You just want to make sure that you're always thinking of ways to protect yourself. Let's talk about prevention. Like, how can we prevent? What can we do? How can we do our part? Simply by washing your hands. Washing your hands. I cannot stress that enough. Washing your hands. Again, you're in the stores. Think about, you don't know what the person before you has done. So let's say you're in a store, or you go into the store, you're going to get a basket. What hands have already touched that basket? You don't know if they were coughing in their hands. You don't know if they were touching something. Just think of the worst. And that should help you, because you just don't know what people are capable of doing. Doorknobs. I'm very observant when I'm out in the public. I try my best to take whatever precautionary measures that I can to help minimize spreading infections or anything. I have watched people cough, pick their nose, and just touch the door, touch the windows, touch the handles. I have seen people pick at sores. I have seen blood spots on doors. You just never know. So please wash your hands at all times. Use some sanitizer. Try to keep that with you. Wear a mask. Disinfect surfaces as much as you can. If you're at a higher risk of severe COVID, protect yourself. Again, wash your hands. Clean and disinfect surfaces or objects that you touch frequently. Avoid touching your eyes, your nose, your mouth. Again, think about when you're out in the public. You don't know who's touched what. The first thing that we normally do is we go directly to our face. You want to not do that. avoid doing that when you're out in the public. Keep a distance of 6 feet from others and avoid crowded spaces if you can. Avoid close contact with anyone who has fever or a cough. I know it's hard to tell if someone has fever, but you can sometimes see if someone looks sick. Um, and again, treat everybody as if they are infected. That is the way that we should all be already. Treat everybody as if they are infected. Maintain a healthy routine that includes exercising and eating nutritious foods. There was an article where scientists found that eating more fruits and vegetables, nutritious food, it lowered the risk for getting COVID and lowered the risk for severe symptoms. So a healthy body, that really helps. So let's try at our best to exercise and get healthy so that we can protect ourselves and protect our patients. Again, social distance. That is one way that we can, when we're out and about. If you necessarily have to go out and you don't have anybody to go out and run errands for you, just follow the protocols for social distancing. Remain 6 feet apart from the person next to you or in front of you. There are places where you can go if you think you may have contracted something, then you can go and get tested. It doesn't take long. There's a little swab. They swab your nose, put it in this little transport specimen container, and send it off. These days they have rapid, where you can get your results in 15 minutes. There's also at-home testing. I've included the link at the bottom of the screen where you can go and you can order your at-home testing. I do think there's a limit per household. So if you have met your limit per household, then I think you will get denied for getting the at-home testing. But you can also find them in your local stores now. That's how convenient they make it for us. You can get it at the store. You can test yourself at home. It's very easy. It comes with everything in there, the little swab, the solution, and the little test agent. It comes with everything that you need to be able to check yourself at home. Let's talk about mask. Do choose a mask that is, something that's comfortable, something that has 2 or more layers. Make sure that you completely cover your nose and your mouth. Make sure it fits snug against the sides of your face and that there are no gaps. I see it all the time, people wearing the mask that only covers their mouth, which means your nose is exposed. That defeats the purpose of wearing a mask. I've seen people wear a mask under their chin. Well, why do you have it on? So just make sure you're wearing it properly so that we can protect ourselves and protect our patients. Vaccines. Check your local clinic. There, even CVS and Walgreens, they do offer vaccines. Make sure you are up to date with your COVID vaccines. I think there's a new one that came out. So if you have not gotten the vaccine, do your part and also do your research if you want. I do encourage you to do your own research, but get the vaccine. There's so much controversy about the vaccine, but if you think about it, we've taken all the vaccines that we could have possibly take. We didn't ask questions. Our parents didn't ask questions. Whatever the schools said that we needed, our parents brought us there. Sometimes they dropped us there, stayed in the car and waited until we got our vaccines. They didn't ask any questions, but now that this come about, there's so much controversy about it. Well, do your own research. I encourage you all to do your research, but getting the vaccine is another step that you can add to protecting yourself and protecting others. Does the vaccine stop me from getting COVID? No, it doesn't, but it definitely helps lessen the severity of the symptoms. Sometimes we have patients with little to no symptoms at all, once they get the vaccine. But definitely do your part, and there are options out there for getting the vaccine. So let's help stop this COVID virus. Disinfect surfaces, hard surfaces, anything that you can wash, please do wash it. Let's help protect our patients, especially the elderly and the small children, those that can't fully fend or take care of themselves. Let's help protect them. Hand washing is the number one key. Make sure you wash your hands. Wash them often. Count to 20 slowly as you're washing your hands. Make sure that when you're coughing or sneezing, you cough into your elbow. Do not touch your face if you can, especially when you're out in public. Make sure that you try your best not to touch your face. Remain 6 feet apart. This says 3 feet apart. Use your best judgment. For me, it's 6 feet apart. If you are feeling sick, stay home. If you necessarily have to get up and get out, make sure you are wearing your mask properly. Make sure that you're not running fever. You're not nauseated, vomiting, having body aches or anything like that. If you are, make sure you contact your healthcare provider or get an at-home test to test yourself. If you are infected with the COVID virus, you do want to quarantine at home or in any place where you can be isolated, like in your own room, for 5 days. Before it was like 14 days. The CDC has now lowered that to 5 days. After your 5 days of being quarantined, days 6 through 10, if you remain asymptomatic, which you're not having any symptoms or anything, then you're free to go out. But I would strongly encourage you to still wear your mask. Check your pulse ox, which is the little oxygen thing that you have on your, you can place on your finger. So here is a video that I thought would be helpful on proper ways to wash your hands, especially when you're in a public setting. So if you can see, we try our best not to use our hands directly. These days there are automatics, so you wave your hand under for soap and the soap comes out. Now there are some places that are still a little bit of old school. You have to manually get the soap or turn the water on, but not using your hand directly, if you can use your forearm or elbow or something to get the soap and turn the water on and off, then please do that. Here is another video of hand washing technique so that we can make sure that we are doing our part. We're scrubbing those germs off. Make sure you get in between your fingers. A lot of us like to wear nails, like acrylic nails, but you don't know what can be contracted under there, what we can come into contact with. So make sure you are scrubbing in the palms of your hands, just so that we can get those soap suds under there to wash those germs away. Clean hands care, protect, save, and care. So again, wash your hands so that we can help stop the spread of this virus. Think about our patients that we are dealing with, especially those that are older and those with compromised immune systems. Wash your hands, wear your mask, social distance, so that we can do our part and stop this virus. If you don't have any questions, thank you all and enjoy the rest of your day.